We have time for just a few questions, and what I'd like to start from Mr. Frogue, one of the questions, accepting that your comments are entirely accurate, which we are from your perspective, what is your alternative suggestion? And what was the first part of that question? Given that we don't have that much time, obviously, but like between what would your alternative be given where we are at currently? What do you think the direction should be?
Well, that's certainly a whole other panel, or at least another couple of hours. I think, let me say something that's extremely broad and beyond the scope of this whole day. About 15%, 20% at the most, of your health status is determined by the health insurance plan you're in, the doctor you go to, and the hospital you go to. About 15 to 20%. And Harvard researchers, Rice researchers, everyone says that. Your genetics may be 20 to 30%. Half of your health status is determined largely by choices you make. Some of it's determined by environmental issues like the air you breathe, and if you live next to a polluting factory, and that's something you can't control in some cases. But the overwhelming majority of health status, or a significant part of it, is determined by things that Congress completely and totally did not address. Let me take this one little piece of advice. In 1990, the fattest state in America was Mississippi. It still is. In 2010, the thinnest state today is Colorado, and it's fatter than Mississippi was in 1990. If a foreign country was doing to us what our dietary habits is doing, our obesity, our explosion of type 2 diabetes, we would consider it an act of war. It is killing our kids, it is killing our adults, it is killing our ability to finance it. We cannot finance a health system with people that are getting sicker and sicker and fatter, to be quite blunt. So the ability to affect individual attitudes, individual behaviors, that's got to be the core. And what actually works, there's a lot of models out there, community-based models, company-based models, that actually are showing success, or people are getting healthier at lower cost. But Congress completely ignored that. Because you know why? Because all the money is donated by health insurance companies, drug companies, hospitals. That's why. So they focus on the 15% of what impacts your health status and not on what actually impacts your health status.
Okay. And what I think we'll do, because a number of the questions are related to alternative proposals, that if we can get something from you following, and then we can put that on the website, and then people can look at that in more detail, and I think it'll be easier to sort of tease through that. Again, briefly, question your comments to some of Mr. Frogue's comments, and obviously differ to some extent from what you were presenting. Mr. Pollack.
Well, other than Jim's last comments, advertising Michelle Obama's Keep Moving effort, I'm sort of breathless with the number of things that he said that are terribly misleading. First, with respect to insurance not being available, his first point was trying to debunk you can keep insurance if you like it. The reality is, with each passing year, people can't keep the insurance if they like it. And they can't get it because the costs are going up. Employers are saying they can't sustain this. And so if you want to keep the status quo, which is, I guess, what Jim is arguing, very few people are going to be able to retain the health coverage. Ask somebody who's just lost their job. They can't keep the health coverage that they had before. And so many small businesses are saying this is simply unsustainable. Jim was saying before that we've got a problem because we don't have enough doctors. That's true. That's not the problem with health reform. Health reform is actually going to provide resources to enable more primary care doctors to be trained. We have a shortage of primary care doctors, and it's something that's a serious issue that needs to be addressed. And I'm not saying that the health reform legislation adequately addresses it, but it takes steps in the right direction. If we want to just say repeal health reform, that situation will not be improved at all. Jim, unlike his boss, who used to count on the Congressional Budget Office for numbers with respect to what happens to the budget The Congressional Budget Office didn't simply say that health reform is going to cut the deficit by $120 billion in the first 10 years, and then Jim would have you believe that in the next 10 years that things are going to get a whole lot worse. Well, the Congressional Budget Office said in the next 10 years it's going to reduce the deficit by over $1 trillion. And how does it do it? It does it by eliminating the windfall payments to Medicare Advantage plans, which now get a windfall of 14%. And that's going to be saving, in the first 10 years alone, approximately $140 billion. It achieves drug rebates from the drug companies of over $80 billion. It requires that hospitals are no longer going to be paid by quantity of services, but rather by quality of services, and it saves approximately $150 billion. Jim, just to I don't know where to end the conversation. He mentioned the Class Act, which is a tax on people seeking long-term care. Well, the reality is you only pay that amount if you opt to do so. Those people who don't choose to buy into Class Act coverage don't pay a thing. It is true that you pay premiums for 5 years, and after 5 years you're eligible to receive a benefit if you need long-term care. But it's a choice of an individual who might want to plan in the future in case they have disabilities. Bottom line is that health reform, it's not going to cure everything in America's healthcare system. Nobody, myself included, would say that health reform is perfect. Whether it's the Social Security Act, whether it was Medicare in 1965, things had to be improved later on, and incremental improvements were made. But it creates a foundation that immediately provides significant relief to millions upon millions of people. It reduces the deficit, and it's going to mean right away we'll have a health system that's more responsive to people's needs. And in the future, those things that I thought were shortcomings and that others think are shortcomings, we will now have a foundation to make improvements.
Jim? We are technically out of time, but I'd like to give you 2 minutes for some final comments.
A couple of things. Obviously, this could go a lot longer than the time we have slated. CBO, for better or for worse, is the numbers we usually have to go off. I'll just give you a quick story from 1996. The chairman of the House Ways and Means Committee, Bill Archer, sent a letter to CBO, and he asked CBO, what would the tax revenue for the federal government be if we raised tax rates to 100%? And their written reply was, well, current GDP. They assumed no change in economic behavior if tax rates were 100%. That's the same thing as assuming if gas were $1 a gallon or $20 a gallon, people would drive exactly the same amount. CBO uses static scoring models that no private corporation or interest uses. They are, for better or for worse, the numbers we have to go with, but their failures over the years have been extremely well documented. But that little vignette from the 1996 story captures it perfectly. That people drive the same amount, whether it's $1 a gallon or $20 a gallon. Everybody knows that's not true. I will say, as far as some successful experiments, one of them is Allegiant Health, which I know you had a representative on the panel this morning, Omaha-based hospital system with facilities in western Iowa. They had introduced a very radical consumer-directed plan back in 2006, and they've done things like paying people with diabetes to enroll with a health coach, paying people to lose weight, paying people to control their A1C or bring it down, paying people to stop smoking. And they've seen significant reductions in overall costs because people are healthier. They're paying people small amounts of money in the short end, which CBO would score as a cost and not the savings. That's the way CBO would score it. But in fact, over the years, they've done really quite well by engaging patients, changing their behavior in a positive way, and you don't have diabetics showing up at the ER, diabetic shock, because it could so easily have been avoided. So the savings on the back end have been tremendous. And the rollover, and by the way, they made their consumer-directed plan optional, and now over 90% of people have chosen to be in it, and they've rolled over millions of dollars that they didn't spend that they get to keep personally. So the incentives are aligned well. The other thing to say about incentives is you have this in Massachusetts, and you will certainly have this with the individual mandate. Massachusetts has been well documented, and this shouldn't come as a surprise to anyone, that people buy the coverage when they need it, blow through a hospital visit, wherever it might need, and they drop it as soon as they don't need the coverage anymore, and paying the fine is cheaper. And people come down from New Hampshire and other places with high costs and can get coverage. There's a small waiting period, but people know how to game it. If you have guaranteed issue, it'd be exactly like if this room was all one auto insurance company and you could buy coverage after your car got stolen. Well, of course that wouldn't work. And that's exactly what we're talking about both in Massachusetts and we're talking about in the national model. There are quite a few other things we could go through. I mean, the Class Act, I don't know what else to say. If the Democratic chairman of the Senate Budget Committee called it a Ponzi scheme that would make Bernie Madoff proud, I can't imagine anything more devastating than that. But beyond that, there's a lot of things. But again, going back to the issue, there is no healthcare system without doctors. And the shortage is bad. It's getting worse. If you're a bright 16-year-old kid and you're trying to decide between, say, going to medical school or law school, well, let's see, I can get out of medical school with significantly more debt, make Medicaid payment rates, or get paid on Medicaid, or I can go to law school and sue those doctors and make a ton of money and only be in school for 3 years and have my firm pay it off the second I get out of school. What do you think you're going to choose? Over the long run, it's not good for all of us if we have fewer and fewer doctors. And it's stunning. One of the most shocking things, and again, I would not take anyone's word for it up here. Ask your own physician if he or she would tell their kids to go to medical school today. The numbers they will scare the hell out of you how low those numbers are. And you don't have a healthcare system if you don't have doctors.
Okay. Please join me in thanking our panelists today.